Ready? Sir stuff. Good morning, everybody. Welcome to the Sedgwick County Staff Meeting of Tuesday, March 9th. Welcome, Commission, again to be here. Thank you. And I'll hand this over to Tom Stoltz.
Good morning, Chairman and Commission. We have 3 items today for staff discussion. First off, Dolores Craig Moreland, right? Is here. It's always just been Dr. Craig to me for 3 decades. So she's here to talk about Crime Prevention Fund, her annual report. And then we have a lot of moving pieces on vaccines right now that we'll tag team between Tim and Adrian and I to talk about second. And then there's a few legislative issues that Mike and Akeem will want to talk about publicly as well. So with that, we'll start with Dr. Craig Moreland, and we'll
I think it's easier if people just call me Dolores.
That's what we prefer.
Good morning, Dolores. Following protocol. Welcome to the County Commission meeting.
Thank you. And thank you for the, is it okay if I talk without this on? I don't.
Yes, that's under the order. It's okay to address.
Okay, it's just difficult to talk after a while. So thank you for the opportunity to go over the highlights of the juvenile justice programs that are funded through your county crime prevention fund. These are programs for secondary prevention that gives opportunities for kids that are at risk, that haven't gotten into trouble. Additionally, there's another tier of them that are tertiary. Okay, the programs that were supported by Sedgwick County Crime Prevention Programs, what was set aside was $548,584, and what was actually expended was around $60,000 less than that. The main reason it wasn't all expended was, of course, COVID, because that curtailed a lot of operations. In addition to that crime prevention fund, the Kansas Department of Corrections Juvenile Services awards $167,000. So that adds to the program funds. Before we talk about the programs, I think it's useful to know the background of the environment in which those programs are being offered. As you can see from the information that's on the slide, the filings fell. They've been falling for quite a period of time. They reached a new low, and it was in part because of Senate Bill 367, which has reduced a lot of different factors in the juvenile justice system, but it was also the impact of different police procedures that were mindful of the exposure risk, so the numbers were really down. A stronger indication of what's going on in the system is the fact that we've fallen from a high of 270 youth committed to juvenile correctional facilities in a year to the 2020 was 136. So you can see that's coming down. That's coming down in part, this year's figure again would be in part due to the pandemic because of that restricted effort, or that effort to keep the environment restricted, but also Senate Bill 367 reduces the use of juvenile correctional facilities as well as the duration. So the combined impact of them meant that the numbers were down throughout the system, the juvenile system in Sedgwick County. That's important to keep in mind as I talk about the fact that a lot of our programs didn't meet their expected service loads. So the programs include, as I said, secondary prevention that's for at-risk kids. We have the Mental Health Association doing a PATHS program. That program is offered to elementary school students, and it's an attempt to help them understand better how to get along without conflict. And PANDO is a case management service connection program that goes to middle school kids. Both of those are serving The effort is made to put them in schools where there's an extreme high-risk population. The tertiary prevention programs that are designed for kids who've already gotten into trouble include detention advocacy services that home-based services from the Sedgwick County Department of Corrections is offering at this point. That is funded through the state funds. Functional family therapy, Higher Ground, which is a substance abuse treatment program, and CBAR, that stands for the Center for Behavioral and Academic Research. It's much easier, as I'm sure you can understand, to just say CBAR. But that is essentially an alternative school program. So you can see that we're hitting programs that deal with family issues, substance abuse issues, and academic issues. The early ones, the secondary prevention is, both those programs are not so narrowly targeted in terms of the impact that they hit. Pando in particular has a range of services that they broker depending on the student's need. And the MHA is getting at fundamental skills for young children to help them deal more effectively with conflict that might result in behavior problems. So the Pando initiative, the service brokering, they received 56,758 and they served 122. 60% were successes. MHA served, they received 36,378 to serve 403 youth. I would indicate to you in particular about MHA that this is a dramatically lower number served than we typically expect from them. Anywhere from 600 to 800 youth receive services from them. I'm sure you can understand that when the schools shut down a year ago now, roughly in March of 2020, their ability to finish and to deliver any programming went to zero. So that had a big effect on them. The Pando initiative normally would serve the kinds of numbers that they have here, but we have generally expected a better success rate than this. This is a pretty, 60% would be a kind of a low watermark for them. And looking at the programming, the main reason that they were not as successful had to do with curtailing services so that they could not finish. If the kids can't finish their goals, they aren't successes. So that's, basically what happened. Services were interrupted, they weren't completed, so they weren't successful. Generally, the impact of the program on those who attended it didn't change that much. The Mental Health Association Paths for Kids, they have exact locations you can see in the program report on page 10. They're scattered pretty much throughout Wichita and Derby, and they had been making some attempts to even broaden beyond that, but those got severely disrupted with the pandemic. So they didn't meet any of their goals because their program is a sustained program, goes over time. It takes them a while to set up the classrooms and make everything work, and they just weren't able to finish any of it. They had absolutely no vehicle for delivering their services once the schools were closed. Pando was able, through telephone contacts and so on, between the social workers and the clients, they were able to do some things. They weren't able to finish the program, but they still had some capacity. The programs for juvenile justice system youth include the detention advocacy, functional family therapy, learning the ropes, CBAR, and Big Brothers Big Sisters. The detention advocacy program, the services there are really designed to assist kids in keeping out of detention where it's possible. So they get case management, they do a variety of different things, whatever it takes to convince the judge that the youth will be stable and safe out of detention. So that's the focus of that. That also includes legal services. They had 69 case management, 81 legal services. The legal services, they attend to all of the detention hearings, and they do follow-up where it's needed if other legal services aren't available. The Big Brothers Big Sisters, this was a first-year attempt. It did not work. We wanted them to provide mentoring services for high-risk youth. The literature shows that that is a very beneficial service for high-risk youth. They did a really big job in terms of trying to recruit youth and their families, because they both have to accept it. The juvenile field service officers arranged facilitated meetings between clients, family, and kids. I mean, everybody did a big thing, and they got one. I think it suggests to us that there is no appetite for this in the population that was targeted. So they agreed that it was not a good fit, and they are not funded this year. So last year was a one and done for them. Ember Hope is the functional family therapy. This program is an evidence-based, it's a research-based program. There's some enthusiasm for this program in a lot of quarters because it provides a system of intervention for families, and families who receive this service have an intensive experience for a period of time. They report in general that they feel more confident, and they're better able to communicate with their youth effectively. So it does behavior management and attitude management. The typical age you can see here, 16 to 17 years of age. If any of you have raised teenagers, you know that's not everybody's hit parade. So they work with families that have a challenging developmental stage as well as challenging kids. 19 youth completed the program. They had a target of 45. They were on track to meet that after the first half of the year, in other words, before COVID hit. After March 17th, they got 0 referrals. And part of that was because the offices shut down and people were working remotely and not having direct contact. And part of it was they also went through a period when they did not have direct contact for safety reasons. So they did figure out how to finish off the majority of the clients that were in process at the time that the pandemic hit. But they've been challenged in their history with this funding. They have been challenged in the numbers of referrals, and they were extremely disappointed to find themselves back in the same corner again, saying, well, we'll figure this out. I did a site visit with them, and I believe that they are trying very hard to find good referral sources where their services exactly match the needs of the client. I do believe that if you look at the different referral sources and how they're doing better, but obviously this is not a boy, girl, whatever you want to say. This is not a high achievement point. Learning the Ropes is a substance abuse program. Learning the Ropes is a challenge obstacle course. That's why it has that name. But the real program is a combination of evaluation and treatment programming for youth who have an indicated need for substance abuse treatment. So this program has been with us a very long time. They have an adult segment that serves the corrections population. They do seem to have a clear understanding of what is appropriate for the youth, and they engage the families very well. They have a high level of family engagement. So, and it's to the credit of this program and the others that they are all targeting moderate to high-risk youth, which gives us the best chance of impact. The Center for Behavioral and Academic Research, this is the 5th year for this program. They serve kids that have long-term suspensions or expulsions. They did serve 30 students. When the school district went to remote, they went to remote. It was very challenging. They got the kids through. 93% of them finished successfully. These are all moderate to high-risk kids. They all have some family issues that CBAR works with and gets parents engaged and improves their understanding. And CBAR has started making referrals as appropriate to FFT so that we get a combination there that could be very effective for kids that are both family troubled and academically troubled. The final point I want, well, it's not the totally final point, but I'm not rescuing you just yet. The final issue, I guess you would say, that seems to be something we just can't quite solve here is racial and ethnic disparity. We look for success rates for minorities and majority kids that are essentially equivalent. They weren't equivalent this year. The success rate for all minority youth was 65%, while it was 84% for Caucasian kids. And at least in part, you can attribute this, because this is a bigger gap than we've had like last year or the year before. And it's at least in part attributable to a disproportionate impact of the pandemic. And I can't tell you all the stuff about that. I believe what I hear, that community is very much, the African American community in particular. The Hispanic community has some of the same issues. They're not as strongly documented. Doesn't mean they're not there. But you can see, when you separate, I had 65% for all minority youth, but when you take the African Americans, their success rate was 52%, Hispanics were 81%. You can see the Hispanic youth, part of that comes from the very heroic effort on the part of Higher Ground to have a very competent Spanish-speaking, Hispanic, culture-oriented staff. A big share of the youth that they serve are Hispanic, so they can take some credit for that decent score. We also look at gender. They stay within 2% of each other. Roughly a quarter of the youth that go through the juvenile justice system are female, so it matters that we take into account gender-sensitive issues, and it appears that they did fairly well. The overview here, during the past 3 years, all the programs, I've worked with the programs, and other professionals have worked with the programs to make sure they're doing a good job of assessing risk and targeting appropriately the kinds of things that will help youth. And I have kept a very close eye on that the last 2 years, and I'm very satisfied that they are all paying due attention to the importance of assessment. So I feel like that's something that we can be very happy with. We've had training for them on evidence-based practices so that they deliver the best program possible. I feel like that's improving too. But there's no getting away from the fact that this year isn't going to be anything anybody can brag about. 716 clients were served. That's roughly half of what a normal year of service would provide. Only 305 clients completed a program. So again, we served about half, and about half that group completed a program. I expressed my concern about minority youth, and I'm making efforts this year to pay attention to things that I think, that research suggests might be helpful. I can't do a cost-benefit analysis because there's just nothing there to work with, so I can't help you with that. Any questions?
Okay, thank you, Doctor, for the presentation. Commissioner Howell.
Thank you, Mr. Chairman. Appreciate, Dolores, you coming and sharing this with us today. So it's good to see how these programs impact our youth. It's extremely important with what we're doing with these programs, and thank you for your leadership on that. I have to ask a couple of questions. I ask almost every year when we hear this type of report. I don't see anything in this report today about the Judge Riddell Youth Program. Is that still, what's the status of that program?
That program is in our juvenile field services.
Okay.
So it's not in the crime prevention program.
Okay, that
So
helps.
that report won't come with us.
Okay.
It's part of juvenile field
Yeah, it's
services.
part of juvenile field services.
Thank you for that. I always want to make sure I didn't miss the date. I
No,
always
you
look for-
haven't, you have not missed it.
Okay.
We all miss the reality, but
And they're still, while even during this pandemic, they're still meeting with kids. They're just doing it differently with Zoom. And actually they are doing a tutoring program through the evening reporting program right now, so that kids that are struggling at home with they can go in and do some tutoring, some extra tutoring.
Very good.
That's going on.
I like to celebrate with the students that go through that program. I like to celebrate and appreciate the fact that program exists as well. And so I'll be looking forward to a report on that sometime in the future. But thank you for that clarification. One of the best measures of these programs. And by the way, people probably might assume that I'm against these type of programs because I'm kind of a fiscal conservative. But I don't think we ought to invest in these programs. I think it actually saves taxpayer money because we solve problems before they happen. So I'm a huge fan of these types of programs. I really think that this is good government. We ought to be involved in these types of programs. One of the best measures of the success of these programs, of course, is what happens in the adult detention part of our community. So, I don't know if we can assess, whether or not we're solving problems before they happen, or we have any sense of what's happening after these kids. How many of these kids are not getting involved in more challenging, more difficult criminal activity, or end up in other types of criminal situations. We're trying to head it off at the pass type of thing. So I don't know how to measure the overall success of this, looking at the entire, from adults all the way down into these younger ages. But is anyone doing any type of analysis on that, trying to connect those dots?
we do have for all of the programs, and there's a summary table in the early part of the report. I don't have it in front of me, but it's a recidivism measure. One of the best things to do is to look at what happens when they're in the program to see if the program is successful while they're in it. Then we look at the first 6 months afterwards. That tells us if they were able to carry forward what they learned in the program on a short duration. Then we look at a year later, and the purpose of that is to see if they were able to generalize the skills. Now that ends at a year after programming, and you make a good point, which is how much of that do they carry forward into adulthood. We are not currently following that, but I get your point. We feel like the juvenile measures of recidivism that are close to the program are the best advisors, if you will, to the people who are delivering the program, because it tells them if they are getting the right kids and getting the right message to those kids in a way that's sustainable. That's what the 6 months and the 12 months measures do. I'm not trying to defend those as the end-all and be-all. I'm just saying it's most effective to have those measurements close to the exit door because people, we all understand that many factors influence your life, and the further away you are from that program, the less you can attribute the things that are happening in your life to that program.
Well, I guess my perspective is if the better the measurements and the metrics become, the more simple it becomes to justify these programs, because you can see that they work. And I really believe that we have to invest in these programs for the medium to high risk population in our communities. It's just absolutely imperative that we do this. And I noticed you talk about a lot of these mentoring programs. Like some of these programs are in the schools, and some of the programs are mentoring based programs. Do we have anything specifically tailored for foster youth?
They are not the specific target. The only way they would be involved in any of these programs, especially that, well, they were not the target for the mentoring program of Big Brothers Big Sisters, and the school-based programs would capture some, but not specifically targeting them, other than the fact that they might be in a school that has high-risk youth. There is another program that's not included in these that's called a crossover youth model program, and that's for kids who receive child welfare services of some kind, and then at some point begin to cross over into the juvenile system. And there is now in place a person who sort of straddles that fence and keeps an eye on those kids. And I think that is a potential area. I mean, it's a group that has a lot of risk associated with their living situation. A lot of them have a history of abuse or neglect or both, and so that puts them at risk. And unfortunately, we can't do everything for every population. So
All right.
that's kind of a cop-out, I suppose. But
I probably have one more question, and then I'll make a comment as well. But do we have any status on our out-of-county juvenile young folks that are placed out of county because we don't have a service here for them in Sedgwick County? Do we have any data on that right now?
I don't have that right in front of me, and I can send that to you. I can tell you the last time I looked, we had 33 kids in our correctional facility in Topeka.
Okay.
And I will tell you that the kids that are now in a correctional facility are the right kids that should be in that facility. And that's what that's what 367 really did, is they managed the right kids that should be in detention and the right kids that should go to a correctional facility. And unfortunately, we've had some youth that acted pretty badly in this community, and they were convicted, and they had a direct commitment to the facility. And I periodically look at that list to see who we have sitting there. We have very few kids in any kind of out-of-home placement other than at home.
Okay.
We are working with the majority of our kids in their homes right now.
Thank you. And I just want to say my final comments. I want to say I appreciate the passion and the smart people that are figuring out how to do this stuff. It's such an important part of our county government, and I think this is an incredibly important thing that we do as a community. So thank you for your leadership, thank you for your involvement and your wisdom and your brilliance and making this stuff happen, even through a pandemic. Thank you for all you do.
Commissioner Dennis?
Thank you, Mr. Chairman. Dr. Craig Moreland, thank you very much for being here today and giving us this briefing. I understand with COVID, everything has changed this year, so it's not just this. Our entire community has changed, so I can understand some of the factors that entered into some of the things that weren't as successful as we would have hoped. Just a couple questions. First of all, one more comment. With programs that serve one youth, I agree that if that's the case, we need to look for other programs as we move forward, so that we do look at ones that are successful. One of the comments that you made, like on Ember Hope, is that their services didn't need to meet the needs of the clients. Well, that does kind of concern me, because if we're providing them funding for a certain job to do, they need to be able to adjust their services to the needs of the client. And I guess that that's foreign to me that they would accept something and say that they're going to do a service and then they don't meet the needs. Is there some reason we continue with them if they're not meeting the needs?
Well, they are meeting the needs of some youth. They receive referrals that consistently don't work out. I really don't want to be too much of a defender because I feel like they're sort of on probation from my perspective. And I think that some of the issue, well, in the past year, of course, some of the issue has been going to remote services, and that's caused some problems. But Ember Hope is standing between a client population and an evidence-based program. They are hooked to, by necessity, in delivering this program, they must work with the National Office for Functional Family Therapy. They cannot use the model unless they're having weekly connections with that service. And sometimes that makes for difficulties for the therapists. It's a tricky balancing situation. I'm not sure that, I do feel like they are getting more and keeping more than they have in the past. That doesn't mean that they're up where we want them to be, but it means that they are moving in a direction that tells me they have learned something about this.
Very good. Well, I appreciate you keeping an eye on that. Another comment that you made was that, especially on racial and ethnic disparity, and as a previous teacher, I understand that the most important person there is that staff or that teacher that has direct contact with them. So the comment you made was that the staff made the difference for the Hispanic population, and I think that's true in just about anything that we do, is that staff makes the difference. So if we're providing funding to an organization and their staff isn't doing what we need in order to be able to do that, make that difference, then again, we need to look for people that are making that difference for our community. My final question is, this program is about $500,000 total program, and we had 218 successes, so over $2,000 per success. I guess I don't know how to equate that. Is that a good number? Is that a bad number? How do I evaluate the fact that we only had a couple of hundred successes and it cost us $2,000 plus for each one of those successes? What is the best way that I can measure that, and whether or not we need to make adjustments?
Well, I would hate to have you make any large deviation from the current practice based on this year, because this is a pandemic year. So, I will just tell you that dollar amount per client served and the number that were successfully served is radically less than we would. If you looked at state fiscal year 2019, you'd see very different numbers and very different successes. So, and we had a program that wound up serving one, and the price for that one, some people would suggest maybe we should have just given it to the family and said, go do something better. That's not my advice, but what I look to, I'm going to step back a little bit from what you said in a way. What I look to help me understand the value of these programs, there's an organization called the Washington State Institute on Public Policy, and they do a great deal of research on child welfare programming, juvenile justice programming, and mental health programming. And they have come up with a research base for the effect size that you should expect with programs, and I use that as kind of my benchmark. They also have cost benefit. I've gone and done their training, and I know how to do their cost benefit analysis. So I don't suggest that we regard, it's a cautionary note, we should be perhaps better equipped to respond more effectively, but I don't know what we could have done to be more effective. I would just say that the programs that you're choosing, when I have done a cost-benefit analysis in the past, I think we've all been relatively happy with the picture that paints of how well your $500,000 is doing. And if you want to know, and it's only statistics supporting it, but if you want to know the long-term benefits, I can get you that kind of information from the basis that I use to judge the fit of these programs.
Well, very good. Well, next year I certainly hope we see better results. Thank you, Mr. Chairman.
We can hope.
Okay. Commissioner Cruz?
Thank you. I guess my questions really are related to what I heard you talk the most about was the number of referrals being down. So I think that kind of goes along with Commissioner Dennis. I mean, if you don't have the youth there to provide the services, you can't really see those measurable outcomes. So the opportunity for success is there, right? But the kids weren't going through the programs because of this pandemic. So we have a good chunk of money that's coming our way in pandemic response. I wonder how we can, I'm not sure what the Treasury guidance is, I'm not sure what it will be and how to spend that money, but will we be looking at different ways to enhance our referrals? I'm sure you guys are thinking outside of the boxes. I know that school is getting back in session, so we'll probably see those referrals continue. But should something like this happen, or how are ways that we could make sure, because the kids are still having issues, right? There's these problems,
more issues.
These problems aren't going away, so we could see maybe an increase of issues that we'll have to combat. So I wonder, thinking in those terms, have you thought about what the impact of having those? I mean, you said we normally would serve around 1,500 clients. We had about half that. We only had 305 clients actually complete the program, where we would normally have around 600 or so. So how are you looking at what this next year will be like, considering all of the kids who didn't go through this program?
With the exception that Big Brothers Big Sisters is not operating this year, the other programs are operating, and they are trying to figure out how to do it. One of the challenges of these kinds of programs in a more general way is you can't scale them up and down very quickly. It takes a very skilled staff member to do something like a FFT or even the PATHS program. And if we had the foresight a year ago to understand what was going to happen for the year, perhaps we could have shifted to more individualized programmings, but the staff aren't transferable. You can't take somebody who's not doing classroom stuff and turn them, you understand what I'm getting at, is there's just not that flexibility. You make a wonderful point, though, which is that while we've been dealing with the pandemic, none of these kids have magically gotten better. I mean, I would say that's virtually true. I think they have experienced more stress, probably more acting out, probably more parents tearing out their hair, among other things.
You're looking at one.
I know it's not funny. It's just the pictures that come into my mind. I apologize for that. But I think what we can say is that whatever the well of need was, it got bigger. And fortunately, it's not directly on point with this, but there is some evidence-based funding from the state that's being made available, and there are some new programs that may get funded. Is that a fair statement? We've gotten the expectation, and we've gotten some proposals for some different things. Among them is a very interesting mentoring and family support program that hinges or pins itself to athletic participation, and aimed at youth who've gotten into trouble, who don't have good recreational habits, some things like that. Sometimes we have to go through a side door to deliver a service, because if you go through the front door, the kid and the family look at it and say, no, not for me. And that's apparently what happened with Big Brothers Big Sisters. So by going through basketball and baseball, maybe we can get a few hooked up with adult male and female leadership for male and female youth that have problems. I'm not doing a very good job of answering you, other than to say I think we're all casting around trying to figure out, given the fact that these are not 100% flexible situations, we're trying to find things that we can do. I don't know if you want to add to that.
And what Dr. Craig is referring to is the evidence-based funds that come to the Sedgwick County through pass-through funding from KDOC. And as you remember, we did a summit in January, talked to our community. They applied for those fundings, and one of the applicants, which the board just approved last Friday, is for a athletic program targeted for at-risk youth, and the board had approved it, so it will eventually come to the BOCC for approval. And it is very promising, and it's something that the community felt that was needed, and it involves family, youth, and mentoring for kids in that high-risk area. So there's several of them that are coming that will be presented on, and that's going to give another fill in some gap areas that some of these programs were not able to actually fill. But you know, Dr. Craig is an independent auditor of these programs, and I'll say she stays on top of them. She stays in contact with them. She does on-site visits with them. She does training with them to keep them on track so that there's not a lot of drift in their program. She asks them to provide corrective actions, just like when pandemic started. How are you going to manage this in this situation? Mm-hmm. And so she really does stay on top of them. And it's just very unfortunate that the numbers were not higher this year, but with the schools closing down, those were some of the avenues that those programs were really infiltrated into.
Sure. It really is unfortunate, but it was completely out of anyone's control. And so I get it that we wish these numbers would be better, because, again, the opportunity for success for these kids is there. We just have to get them in the programs. So, you know, if I would be a proponent, if we need more resources, I think it's important to look at things that we could do differently, especially if there is money coming to our county. I get it. We're very focused on economics. We're very focused on getting our economy back together. But I think when we have healthy kids that grow into healthy adults, that is an important piece of this puzzle. So thank you for being here today. I appreciate this report.
Thank you, Commissioners. I don't see any other questions or comments, so thanks again for the presentation. All right, Tom, next up.
We'll shift the discussion to vaccine update, and I think Adrian's going to be on the phone, and we'll let Tim go through his update. And then I think we've finally reached a point where the vaccine shipments in are reaching stability and actually increasing. So we've got some unique kinds of opportunities now to increase vaccinations for the public, which we'll go over here. So Tim, take us through the
Good morning,
update.
Commissioners. Tim Kaufman, Deputy County Manager. I'm going to provide you an operational report, what we've done at our vaccine clinic this past week, and some cumulative information as well. So last week we had a very busy week at the vaccination clinic. We had the opportunity to give 9,700 first doses, over 5,000 second doses. Those 9,700 first doses now, 3 weeks, will turn into second doses as we schedule folks. So for a total of almost 15,000 doses dispensed at the vaccination clinic. That's a lot of folks that we've walked through there. That brings us to a total of 61,594 doses that have been dispensed by the health department. We're still refining our PowerPoint. The total number that have received their second dose, and so they're considered fully vaccinated, is 20,649. We'll get that on the slide next time. But again, 20,649 that we have vaccinated for a second dose. And again, as we've talked many times, there are other vaccinators in the community. There's other vaccine that's coming into the community. And we're working right now to account for all of that as well. We're going to have to do some manual processes and some phone calls until we can get something worked out with KDHE to get that number reported to us. As we talk about where we're at now and some of the things that we've got going on, so through today, we are scheduling appointments for residents age 65 and older, K-12 school personnel, and healthcare associated workers, and we started with veterinarians at the end of last week. At the end of the day, we're going to update our scheduling tool, and we will also make appointments available for people that work in a number of different employment areas. So folks that work in public safety, individuals that work at a licensed child care or daycare facility, employees of meatpacking plants, aviation manufacturing employees, and then public transportation employees will all be able to begin scheduling vaccinations tomorrow through the course of the week, and then we'll have next week's appointments open as well. So our goal is to get as many folks as we can in those employment categories vaccinated, as well as individuals that are over the age of 65 and K-12. Nobody ever doesn't get access once we've moved on to another group. So healthcare associated workers are still going to be able to schedule appointments. Residents over the age of 65 will still be able to schedule appointments as well. We are doing some things this week that are new. We've got clinics at Textron Aviation and Spirit Aerosystems. Both of them are going to be small, and they're going to give us a sense of how those operations are going to work so that we can ramp up numbers going forward as we add those aircraft manufacturer folks to the list of people eligible to test. Textron, we're able to do a transfer. They've gone through the process to become a vaccinator. Spirit Aerosystems, we're going to work with them. I think I've described partner pods with you before, where we've got some staff and they bring some staff. And then we're going to do another outreach opportunity this coming Sunday at Tabernacle Bible Church. We'll have an outreach event there. And then we're continuing to work through the process to get vaccinations into congregate settings. There are a number of licensed congregate settings in the community, and we're working through the process to make that happen. The vast majority of those vaccinations are going to happen on site, and so we'll work with partners to make that happen as well. And for anybody that needs more information, we've got a pretty robust website. That's also where people can go to schedule appointments, and I'd be happy to answer any questions you may have.
Okay, Commissioner Dennis.
Thank you, Mr. Chairman. But before I have any questions, first I want to congratulate the Health Department on the job that they're doing over at the library and the drive-through. I've received nothing but positive comments every step of the way. Minor questions that came up were things like home show and gun show and so forth on parking, but those are really the abnormal comments that I'm receiving. The bulk of them are just absolutely positive. I've been over there 5 or 6 times myself to see the operation, and it's fantastic. So I just want everyone to know how proud we are of what's happening over there. A couple questions, though. Actually, just a few minutes ago, I got a text from somebody out of Coke Industry and said that they heard that there is an increase coming from the state on more vaccines and more help. Can you expound on that a little bit? Because I couldn't answer the question very well.
we did have a conversation last night with KDHE, and they are in a position to be able to provide us some additional staff. And so we are scrambling right now to put together some clinics Thursday, Friday, and Saturday. We believe we'll get that worked out. We don't have all the details worked out, so we're not ready to make that full announcement yet. But we will have some additional help, and so we'll be able to operate with KDHE provided staff a second mass clinic. And we know that manufacturers are increasing their production, and that means additional vaccination coming into the state of Kansas, which means corresponding increased vaccination coming to us. And so we're anticipating both of those things to be happening in the very near future. And so we'll continue to extend and expand our capacity at 223 South Main, and we're going to work with a number of partners to get vaccines to them so that they'll be able to dispense vaccinations in to the same population groups that we're vaccinating in our clinics.
Okay, going along with that, how many doses are we receiving now per week?
The standard doses that we receive are 7,020 first doses and 7,020 second doses. And we have received occasionally additions to that. An example would be that 3,500 doses that we received for teachers. Last week we received 3,800 doses of Johnson & Johnson. But the standard dosage right now is the 7,000 and 7,000.
Okay,
We
and how
believe
many,
that number is going to go up, though.
and how many do you think we'll get when the state starts providing additional support where we can stand up another facility?
We don't have details on that number yet. I would hope that we'll be able to process with additional staff another 1,500 potentially each day. And if we're doing a 3-day run, that's another 4,500 folks.
Well, that's great news. Another text I received this morning was asking about meat processing plants. This organization that texted me, honestly, isn't Smithfield, I think, or Dole. They're one that supports them. How do we identify which people that we vaccinate under this meat processing?
The additional vaccine that we received was for those two facilities, the Smithfield and Dole workforces. If there are organizations that support that, we'd sure be glad to talk to them and figure out how they fit in with the state's plan and our plans. And so I would encourage them they could even contact me, but certainly call the health department at 7300 and get that conversation going.
Great. I appreciate that. Two final questions. Have we heard anything back from our letter to KDHE and the governor?
Well, I think I'll let Tom cover that. He addressed that a little bit yesterday. We don't have formal response yet, but.
That's correct. Commissioner, we have not received formal response back yet, but we have received verbal response on a couple of different levels. Dr. Nielsen on her Zoom meeting last week seemed to indicate that several counties were asking to elevate Phase 3 people into Phase 2 groupings, and she pretty much said on that video conference that was not to be allowed. We were going to try as a group, as a state, to work through Phase 2. Dr. Minns talked with Dr. Norman directly, and he indicated the same message, that we're trying to stay within Phase 2 and not go to Phase 3. And then I had discussion last night on our phone call with the state with Phil Griffin, and he confirmed also they all understand what the ask is from the commission, but all of them seem to answer no with, we have to stay within Phase 2. Let's get through Phase 2 as fast as possible so we can get to Phase 3 and then take care of this group. So those are three verbal kinds of exchanges we've had, but we have not received anything on paper yet or an email.
Okay, well, I'm a little disappointed. It's been almost a week, and we haven't received any kind of written response back from the governor. And I'm also, I understand the phases, but what we're asking is this group of people that have severe underlying health conditions be moved into Phase 2. We're not trying to move into Phase 3. We just don't believe that their priorities are in the right position. So anytime that you have a discussion with them, please let them know that we think that those people need to be in Phase 2, that we're not trying to jump into Phase 3 right away. And the final question that I have is that I've sent we've had a couple of meetings through KAC with Dr. Nielsen. I know that I've asked the question a couple times. I know that you asked the question at the last one also. How many vaccinations have we accomplished in Sedgwick County? We need that information so that we know when we get to the point where we're getting close to herd immunity. We know exactly how many that Sedgwick County has given, but we don't have an idea whatsoever how many the hospitals have given, how many pharmacies have given, how many have gone into long-term care facilities, how many that the VA has given. There's just, right now, we can't make good decisions as the Board of Health unless we know how much of the community has been vaccinated. And I would think that the state of Kansas, that would be a very easy answer. So please, every time you talk to anyone in the state of Kansas, let them know that we need to be able to make great decisions as the Board of Health, and we can't make those decisions if we don't have any idea where we're at on the vaccination process. That's all I have. Thank you, Mr. Chairman.
Commissioner Lopez?
Thank you. Now that we're starting to receive more doses every week, are we going to be using, our community partners more like Health Corps, Grace Med, Hunter Health? What does that look like?
We continue to have conversations with them to see what their capacity is in terms of the amount of vaccine that they can take and handle and dispense appropriately. One of the things that we've run into this week is folks that we had lined up as partners to receive vaccine transfers from us are starting to get increased vaccine from the federal programs that they may participate in. And so the need for them has diminished, and so we've looked to other partners as well.
And then once we give vaccines to different areas, how are we tracking if they've given them, or, are we getting that information just to verify that nothing's being sat on?
We have reporting requirements in the agreements that we're signing with each of these partners, and reporting is a critical part of that. So they need to report back to us what they've dispensed and that sort of thing.
Okay. With the Johnson & Johnson, do you know, are we going to start receiving the 3,800 doses? Is that going to be like a weekly allotment like we have with the other ones, or?
No, the Johnson & Johnson is going to be coming in. It's a little bit different in that they were waiting for their authorization. And when they received that, they were sitting on about 4 million doses that they shipped out nationwide. And so but they indicated that it was going to take them a few weeks then to get their production back up so there would be more to dispense. I think that we are anticipating maybe the end of this month, more likely early next month, there would be a significant increase in Johnson & Johnson coming to our community and across the country. But we'll go a couple of weeks for sure without any additional Johnson & Johnson.
And how are we determining who's getting the Johnson & Johnson vaccine versus the other two?
So we're working with Dr. Minz on that to help us make a good decision. We had identified a target group that we were going to dispense Johnson & Johnson to. In the meantime, they made arrangements with another entity to do that vaccine. Ideally, with Johnson & Johnson in particular, we want to target individuals who may struggle to come through for a second appointment. And so an example would be our homeless clinic or our homeless shelters. That's a difficult population to get scheduled. It's a difficult population to get to come back either 3 or 4 weeks later. And so from our perspective, that's a perfect group for that sort of thing. There are other people who may find the vaccination process trauma-inducing, and so we're going to try and figure out how to reduce that impact on individuals as well. So we're continuing to refine those details.
Okay. How long will the drive-through stay open? Now, I know that was going to be for 65 and older, but now that we're winding down there, is that going to be going for a while longer?
We had a conversation earlier this morning. Right now, tentatively, our plan is that we will have first dose appointments available through Saturday, and we will then have second dose appointments available for roughly 3.5 weeks to get that wrapped up. And then we will no longer do the drive-through in the sense that we've been doing it. The staff that are working in those settings, we would then convert to mobile outreach opportunities. And so
Okay,
that
good.
we're going to still utilize those folks. We're just going to use them in a different way.
Okay. And one thing I just haven't heard an update on recently are the issues we were having with reporting, not necessarily the health department, but other areas, and with the state getting the doses reported correctly. Has that been resolved, or where are we with that?
My impression is that it's better, but I don't think, particularly statewide, that has been fully resolved. There is a team of KDHE staff and consultants that are working on just the data reporting process. They've changed one of the processes, and so we do a nightly report. All the approved vaccine providers do a nightly report to try and get that data a little more clear. So I wouldn't say that it's completely resolved, but I think that there's been significant progress made.
Okay. And my last question is just going back to the letter we sent to the state. I understand that they're saying they don't want to change or fix phases or whatever the case may be, but have they given a reason why they don't want to do that beyond just they don't want to move phase 3 people to phase 2? I mean, it seems like this group of people is going to be such a high risk that we would want them to be more of a priority. So I guess I don't know if we can get a better understanding of why this is something they're pushing back on so much.
I'll take a stab at that, and then Adrian's on the phone too. I'd maybe like to hear her slant on that. When we were talking to them, they referred to the comprehensiveness of the phasing approach that they endeavored upon, and there's moving pieces to that. And one of those was to keep the virus from spreading and to keep the economy engine going within the county and the state, and that's a part of why these work groups, all of them important, all the way through phase 2, to target that group, to try to juggle all of this together and to basically keep economy going. Everyone I've talked to, Phil and Dr. Nielsen, they understand what the commission asked for, and they see the merit in it. But they also see the merit in the comprehensive phase plan, which they spent weeks and weeks developing to see that through. So that's the best answer I can give you right now. Adrian, do you want to add anything to that from your perspective?
Hi, Adrian Burns, Sedgwick County Health Director. No, Tom, I think you covered well their perspectives.
Well, I guess my concern with that is that plan was created so much earlier than where we are today. And with our numbers looking the way they are, it seems like we might be able to adjust that. I understand that where they were thinking some of these things in the beginning, but we're not in the same place we were months ago. So, and then I also just, one last question, because I know this is something I've been getting asked, as I'm sure are my fellow commissioners too, about masks and getting rid of masks. Have we looked at, let's say, if we get a certain percentage of our community vaccinated, or what would be the threshold to then remove masks? I know, CDC just put out a big thing about keeping masks going for now and just kind of getting through this last little bit of time, but do we have an idea of when we could look into that a little bit more, or?
We've talked to Dr. Menz about that, and this gets back to Commissioner Dennis's question about vaccinations within the county, and I wanted to comment on that before we stopped. We have been asking the state for that for weeks because we haven't been able to wrap our hands around what the other partners in the community who are receiving direct federal allocation are doing. Dr. Nielsen, on the video session last week, we asked her the direct question, and her answer was, we're working on that. We don't know when we're going to get you that. And Dr. Menz talked to Dr. Norman, and he essentially gave the same answer. So we have a couple of strategies that we are working with KU Med to do at this county level to get that answer, because that is one of the three really important metrics that Dr. Mins and the Board of Health needs to have to make decisions going forward. We understand that. So Dr. Ablaw and her work group are trying to, there's two strategies. One is to try to get data, existing data from a state or federal system of what has gone out to each individual partners and comprehensive list what that looks like. If that doesn't work, we're going to pick up telephone. We're going to call every single entity out there. So we've got two strategies working at the same time with the goal, today's Tuesday, with the goal of by Friday being able to give the Board of Health or Dr. Mins some idea of, in a population that's we can give a vaccine to, which is roughly 400,000 in Sedgwick County, how many are fully vaccinated? That's just the core question we should be able to answer. And it's, I hear your frustration on not having that. We're frustrated with the state as well. And I know they're doing the best they can, but we're going to try to come up with that number locally. So when we get to that number, Commissioner, to your point, I think Dr. Mins then has everything he needs to look at, which is infection rate, hospitalizations, how far have we vaccinated into the community, and can then make a more logical decision, which he can present to the Board of Health for review.
Okay, thank you.
Okay, Commissioner Howell?
Thank you, Mr. Chairman. Just comments and some questions here. So there was an article that broke in the Eagle last night. It's titled Aviation Child Care Meatpacking Workers Eligible for COVID Shots in Sedgwick County. And in that article, it says something that I thought was a little surprising to me as a commissioner, and I would like to have some discussion about it. But it says Stoltz, and it's referring to Manager Tom Stoltz, said the Sedgwick County Health Department had received about 140,000 doses of COVID-19 vaccines and had administered about 60,000 shots as of Monday. And so I'm getting some questions from my constituents about, are we stockpiling 80,000 doses, which is actually more than we've actually administered? There's some concern that we're not getting the vaccine out quickly enough. Can you please comment on how much we have in storage? And I guess let's start with that question.
I'll go first, and then Tim and Adrian can fill in the blanks. What we had yesterday, and I haven't looked at the numbers today yet, was roughly 27 to 28,000 primary doses available that we were scheduling, and we're knocking out at the library 2,200, 2,300 shots a day, and about 15,000 secondary or booster shots. So we've also transferred out several thousand doses to partners, including a lot of transfer doses so that schools could get vaccinated. And I think when you combine all those numbers up, it's going to get us to that 140,000 level. The key piece of this is for the first time for the first time ever, we feel like we have really good vaccine supply inflow coming in now to where we can begin to look at the second mega site with KDHE and really begin to discuss seriously with our partners other mass vaccination. And I'm talking, hundreds of vaccines per day at sites to continue to move this vaccine. I'll take you back in time to the week of February 15th, which was a couple of weeks ago. We were down to almost having to shut the clinic down because we didn't have vaccines to give to primary doses. So that's how time works with COVID. And now after that, we began to get shipments after the snowstorm. Now we are in a place where we have the other extreme, where we need to get creative and we need to move this vaccine, and we understand that. So that was the discussion with the state of Kansas last night and what they are offering now to urban counties, and it's not just Sedgwick. There's other urban counties that are in the very same place we're at. To be honest, I think we're behind what happened in the rest of the counties in the state. And it's not just Sedgwick, it's Johnson and the other urbanized counties. I think the state's making an effort now to get us caught up. So we will begin to, as Tim mentioned, effective Thursday, have 2 large sites going, and that supply will go down very quickly.
So I don't know about my colleagues, but I would like to have a status periodically on our inventory of COVID-19 vaccine. I think we have a right to know what that is.
The Board of Health gets that status every day. The Board of Health gets that status every day from Adrian. She gives you a written report every day. It's a 6-part report, but within that report is that number.
Okay. you mentioned we had 27,000 first doses on hand
That was yesterday's
as
number.
of yesterday. And yesterday we had about 2,000 appointments at the vaccine clinic. About I would assume about half that maybe was first doses, I assume.
Correct. Yeah, we're running about 50-50 first dose, second dose at the
So we have
library.
several weeks worth, even at that rate, we have
Yes.
several weeks worth of vaccine.
If we don't change operations, that is true. We have to change operations to get that vaccine out faster. We understand that.
Okay. I guess I would like to just encourage us, even yesterday, I was in the vaccine site yesterday, and I noticed there was lots of capacity yesterday. So I would say at least half of the chairs waiting for someone to get a vaccine were empty. So I don't know what the status, I'm not sure what the appointment status was yesterday, but it seemed that we have plenty of capacity, even just yesterday, available.
I agree, sir. That was one of the reasons that we looked at the library. There is capacity there. I think Tim mentioned we're looking at increasing hours and increasing the number of doses at that site. But even with that, even with increased capacity there, we know there's room for another, we feel like there's room for another mega site, and we're going to make that happen. And we also know that there's room for our other partners to take doses if they can manage them and put them out. The thing that's interesting this past week was, as Tim mentioned, some of our pharmacy partners are getting direct federal vaccines. So now we were planning to moving several hundred, several thousand doses to them, and they're receiving from the federal pipeline. So they can't use our doses. They don't have room to use our doses. So we're reaching out to other partners, and we'll come up with something creative to move and get that. And stockpile is the wrong word. You need vaccines on hand to run mega clinics. But that number in my world should be around 10 or 15,000 doses, because that gives you about a week's worth of capacity to run the clinic. And we have twice that now. So we know we have to move it. We've talked to the state about it. They agree we have to move it. And we've come up with some solutions to move that within. I think you'll see drastically different numbers within a couple of weeks.
I know that Governor Kelly, when she was here last week and we had conversations about this, and then Senator Moran just yesterday, one of the things that commissioners emphasized with them was we need more. And again, if we ran thin on vaccine, it makes a better argument because we're getting it into the arms of people. So I would rather have that number as small as possible.
I agree.
I'd be fine with even running out, frankly, because I think that shows we're really intent on getting it in the arms of people. And I would rather run out and tell our community that we're advocating for more. We don't have any more. We're doing the best we can. To me, it's a much better message. I would rather be in that situation. Back to the letter to the governor, I would also just emphasize once again the CDC guidelines, which is what the state claims they're following, actually has those with underlying health conditions ahead of many of the groups we're offering the vaccine to right now. So, again, I would just say once again, I'm disappointed that the state has not heard the county commission. I think that they are wrong in their decision. I would like to continue to advocate as a board, and certainly as I talk with my constituents, to contact the state to let them know. I probably get more negative email on that one topic and more comments being made in the social media regarding this, in my opinion, a bad decision by the state of Kansas. So I'll continue to advocate for that. I respect that they have the right to make the decision. I just disagree with their decision. And then I'll just say, with respect to pulling out different groups in phase 2, I think we could make a choice at this point. I understand we have some on-purpose programs to focus with the aviation workers. I think that's fine to focus some effort in those areas. But I think at some point we just need to lift the gate up completely on phase 2, and say everyone in phase 2 can come forward. I think we have, again, other counties actually have done this. I think in a sense, it's kind of offensive when we make value judgments on which group we want to allow the vaccine to go to, and some groups we're going to hold back. To me, it can be offensive to some people. And I think there's an argument that can be made that says we just need to lift the gate up and let them flow in. Again, if we have capacity and we've got vaccine on the shelf, I would rather see us have the greatest response from the community as possible to get this vaccine in the arms of as many people are willing to take the vaccine. I would agree with Commissioner Lopez. I've received a tremendous amount of email and calls regarding the masks. I do think we need to have a conversation. I wish we had some objective thresholds we could look at that says when we hit these thresholds, we are going to do something specific. And again, I think we ought to, as a group, be talking about lifting the gathering limits. I talked about that last time the health order was discussed here at the bench. I think the gathering limits is our next big thing we ought to try to move away from. At some point, we need to move towards recommending masks and not mandating masks. I think that's something we need to discuss as well. Let me point out that back in November, from the 8th through the 21st, that was our peak number of cases that we received in the county in terms of positivity rate. During that time, we had 6,819 people in a 2-week period come forward and say they tested positive for COVID-19. And by the way, I guess I still believe there's a lot of folks out there that are getting sick and not being tested. So I would like to think that there's a lot of folks out there that are actually having COVID and probably creating antibodies that they've made a choice not to be tested for some reason. That number is probably much higher than 6,800 people. Last week, the last 2 weeks, our number was 591 people in Sedgwick County have had the vaccine. That's only 8% of what we had back in November. So our numbers have just absolutely plummeted, as you all know. One thing I've also noticed is, again, we look at the positivity rate, which right now shows on the dashboard is 2.9%. But what you also need to understand is that the testing rates have actually plummeted. And you have to keep that in perspective, because as the testing rate goes down, that positivity rate actually represents a much smaller number of people. And so you have to take both ideas in at the same time. Our testing rate's actually about 1/10 what it was just a month and a half ago. And so we are very, very low on our testing right now. And having said that, we still only have 2.9% of the positivity rate. So I guess I would be in favor of certainly dealing with the health order sooner than later. I think that the gathering limits needs to be removed, and I think that the masking ideas need to move towards a recommendation rather than a mandate. And by the way, I think at some point we're going to have to dispense with the idea the CDC did state yesterday that people who are vaccinated don't need to wear masks when they're around each other. I think we need to have some understanding of how we're going to manage that in Sedgwick County, because I know there's some concern about, the mask is a visible thing. You can see someone from a distance that has a mask on, and there's no way to know whether or not that person's been vaccinated or not. I think at some point we're going to have to move towards trusting the people that those that have been vaccinated have some additional freedom that those who have not been vaccinated may not enjoy. So at some point we need to have that discussion as well. Thank you.
Commissioner Cruz?
Thank you, Chairman. Not to belabor the underlying health conditions point, but I received an email from a gentleman who discussed his 83-year-old mother taking him to the vaccination site. He's 64. He's unable to get the vaccine because he's not 65, but he has Parkinson's. And so I think that just these real stories are very real in our community. So when we talk about keeping people out of our hospital system, those who might contract the virus that would potentially have to go into our hospital system, rather than vaccinating someone who's healthy who might be an aviation worker. There's just so many variables that I think we really have to pay attention to. So I think that we have talked about that enough, but that's one thing that I just wanted to share. The other thing, and Kate has had this for me, she's going to pull this up. This is the state of Kansas data reporting. So as you can see, once we get it figured out, if you click on the vaccine distribution go over that, click that. So go down a little bit, please. Well, there's a graph that's supposed to be showing up, but it's not showing up. So this site, when it works, it shows that the total state distributed vaccines, the state distributed is 837,000. The federal pharmacy program, which they have the information posted on their site, says 183,040 vaccines. So to Commissioner Dennis's point, they know how many of the federal pharmacy program is coming in, how many are distributed per county. So can we get that information? The other point that I want to make that isn't being shown there, for whatever reason, is the first dose, number of first doses distributed by county. It has listed for Sedgwick County for this week, 11,000. So my point that I'm trying to make here is that if we are receiving 14,040 doses, how come it's only reporting 11,700 there? We are being held to a high standard to report things. I wonder, where is the disconnect between their reporting and our reporting? Every single dose that it comes into our community is important. We talk about not throwing away any doses. I just wonder, where is the disconnect between this reporting and our reporting, what's coming into our community? When you guys have these conversations with Dr. Norman, I don't have these conversations with him. I don't have conversations with Dr. Nielsen. These are the questions that I think we need answered. I mean, we need to know how many, I mean, they're reporting it on their site and it's incorrect according to the numbers that we have been, I mean, because if we've received 7,000 first doses and we've received 7,000 second doses, why is it reporting wrong on here? So, and I know you can't answer that question. I'm not blaming anybody. I'm just saying there is some sort of disconnect that I'm having to answer to my constituents around the reporting of all of this and why we're doing what we're doing, yet we can't get these answers.
Well, a couple things to that, Commissioner. Yes, we will bring that up to the state every chance we get. And we are fortunate we have Seth Conkle that works with us as a contractor. He also works for the state, and he is a conduit for us with KDHE. So we'll continue to bring that up. But I find ourselves today with vaccines where we found ourselves with testing and with other kinds of measurables with KDHE. And we end up, I report to you who represent the people of Sedgwick County. And so I find myself saying, I guess I don't care what's going on in the rest of the state. I want to know what's going on in Sedgwick County. And I want the best numbers here down to the dose of what we're vaccinating. And that's what we aspire to get every single day from the county. And we're going to, one way or another, try to glean that information from our local partners, pharmacies and our FQHCs and other people who are receiving direct doses from the county. We're going to try to get that because that's important for you to make decisions. The state reconciliation of what these numbers are and where the disconnect is, we'll continue to have that discussion. But our job, my staff's job, and our health department's job is to report to this Board of Health what we're doing in this county, and that's takes precedence overall. We'll try to get the state numbers reconciled, but that's outside of our wheelhouse right now, but we will continue to talk with them about it. We've gone through this. What's frustrating is we've gone through it all year with the state. We had to do our own testing numbers to get accurate numbers in Sedgwick County, so it's frustrating, and I know they have it's a big state. There's 105 counties. They're doing the best they can, but we're trying to get best Sedgwick County numbers we can.
Well, and I guess that, you know, in a way, we received 3,000 more doses than they're reporting here, but if they're not reporting 3,000 doses on there, where are they going? I just think, I'm just concerned.
We've talked about this before too. Part of the problem is when the original dose allocations went out, the assumption was when you got a vial of vaccine, you could get 5 shots out of it. And we have determined through practice, through operations, you can really get 6 out of it. So now the numbers have to change. Instead of getting 5,000 in some doses, that's why Tim uses the number 7,020, because it's the same dosage as we've been getting for like a month, but we have determined through practice and operations that the nurses are able to get a 6th dose. So that number changes. I don't know if the state's numbers haven't caught up with that reality, that when you send vials out, instead of getting 5, you're getting 6 shots. That's been a part of it. We've been advocating that, because they all recognize it. We all recognize across the state, not just in Sedgwick County, you're getting 6 doses. It's in Wichita County and Johnson County and everywhere. You get 6 doses from the vial if you manage it. So I don't know if they've not reconciled those numbers. That could be part of the problem with the state reconciliation. But what we give you on your daily report and what we report to our public here is the actual doses we've been giving at the county.
Well, it would be interesting to get a report of how many doses Sedgwick County has received from the state and then how many we've received from Sedgwick County Health Department, and see if those numbers match. Yeah. I'm interested in seeing that. Is that something that we could receive?
Sure. We'll try to get the state data reconciled with our own.
Thank you. And then the second part is I'm excited to hear that we're going to be receiving more doses. I mean, that's an exciting thing for our community to hear. What sites are you looking at as a second mega site?
We're going to actually have a meeting after this meeting to talk about mega sites, but we're considering pivoting the extension center, moving testing to a smaller site since we're cutting down and use extension for the mega vaccine site. We have had discussions with Heartland Preparedness. That's a little bit hard to get to geographically, so we're trying to make this a very easy, large site. So we'll have you information on that by end of day or early tomorrow, and we'll, of course, announce that to the public before it's operational. But we're looking for a site that has plenty of parking, easily accessible, ADA accessible, and we'll figure that out today. Remember, the news from the state that we had is last night, so we're still, there are not enough minutes in the day to do it all. Right now.
So I'll just remind you, the Save Our Stages crew is, they are doing vaccination sites all around the country at venues. We have a few venues here in town, so that's an option as well.
Very good.
Thank you.
Okay, I think I didn't have to say anything because I think all the commissioners have covered all of our anxiety areas. So I echo most all the comments that have been shared. So thanks, Adrian, to your staff.
Sorry, Chairman, just one final comment. Since somebody asked about J&J, because we think that by end of month we're going to be receiving many thousands of doses of J&J. These vaccines are all exceptional. Pfizer, Moderna, and J&J. So at some point, we will no longer target who gets J&J. It's just going to be at the vaccine site. And some people, it's beginning to be like we need a menu almost. All of these vaccines are exceptional, but it's possible that at our mass vac site, we may have like a morning or a day of Johnson & Johnson. For those people who prefer that, they could sign up for that exact, if that's what they prefer. And if not, then they can sign up another day. So we're looking into that. It's not reality yet because, quite frankly, we haven't received enough J&J. But if and when we do, we know we're going to. We know by early April we will have a lot of Johnson & Johnson to distribute, and these are all excellent vaccines. So we'll figure out a mechanism for that and keep you aware. That's the last thing I wanted to just add in.
Okay. That has created another question. Commissioner Howell.
Thank you, Chairman. Just a clarification. So I'm going back to the vaccine numbers a minute ago. Again, my confusion, I guess, comes from the idea that in that article, it said we received 140,000 doses, and my math looks like we've only received about 111, which would account for the disparity that I'm looking for. I guess I'm trying to figure out where that 140,000 number came from. That's not what the vaccine status shows from.
As soon as this meeting's over, we'll we have a conference call with Adrian and Seth. We'll double check those numbers, Commissioner, and get your report back on that.
Just to FYI, by my numbers, what I've been provided, it shows about 111,000. So that would be a significant difference in why the math isn't working out for me.
We'll double check that.
All right, thank you.
Okay. Thank you, Tim. Thank you, Adrian, and your staff. Again, as others have said, the library staff is a very efficient operation and nothing but compliments usually, except for parking. But as I said before, I used to have, when I was at city council, parking was always a problem at that library building anyway. So that's nothing new. Okay.
Well,
Next.
we'll move on to legislative agenda. I'm going to have Kate hand out a one-pager that's going to go on our website. This kind of summarizes phase 2 that you can just take a look at. We'll be putting that on sometime later today or tomorrow onto the website, just as an FYI. With that, Akeem, I think, had a couple of legislative issues to talk with the commission about, and Mike will also have some chime in. So
Mike will also chime in.
Okay.
Good morning, Commissioners. Akeem Ashford, Communications Director. So I just want to kind of give you a brief history. We're going to talk today about Senate Bill 286. You guys may remember we had conversations before about Senate Bill 149 and then House Bill 2142. Just to give you guys an update, Senate Bill 149 has a hearing on Thursday at 9:30, and then House Bill 2142 has a hearing today at 3:30. So that's just kind of the textual information. Kate did pass out a document here that goes over Senate Bill 286. similar to the other two, but has a lot of additional details that Lindsay has outlined for us. And so at this time, I'd like to invite Lindsay and then Mike for comment as well on Senate Bill 286.
All right. Good morning,
Morning, Lindsay.
Commissioners. So I will try and quickly summarize Senate Bill 286. So this bill in general seeks to provide an avenue for relief for businesses that were impacted by various government orders. And so it lays out in some detail, pretty complex, how that will happen. So just to quickly summarize it, this one is a bit more complicated than the last bill that we talked about, because not only does a restriction for purposes of this bill count as either a closure or a capacity limitation, it also includes a curfew. And so it does expand that. It also, if you look through the text of the item, a mask mandate as of May 1st, 2021, also becomes a restriction under which compensation can be requested. So working through this, one of the most interesting pieces is that it seeks to set aside $100 million of future federal funding received after January 1st, 2021, to be put into a fund for use by the state attorney general to settle compromises, settlements, and final judgments. Now, it does say that that money would have to be, that bucket has to be expended at the discretion of the state and unencumbered. So they can't, if they get money for vaccines or something like that, they can't redirect that funding to another use. It has to be their discretionary funding. And then it also says that this basically, if someone goes through and takes advantage of this bill, it limits their ability to come back later and seek additional relief. So all claims would have to be filed by the end of 2022 in order to be considered, or 365 days after the state ends its declaration of a disaster emergency, whichever is later. So most likely we're thinking probably the 12/31/2022 date based on what we've heard so far. The bill goes further to say that this is going to be administered entirely under the authority of the Attorney General's office. There's no room for deliberation or discussion or determination by a local government body as the prior bill had. So in order to be valid, the business has to have been impacted by COVID-19. They would submit an application. We have no idea, obviously, yet what that application form would look like, but that application would have to include basically the number of days that they were ordered to cease operation, the number of days that they were not closed maybe, but were further restricted, the government that was responsible for issuing the order. And it basically says that if there's a state order and a county order or a city order or anything that are in place at the same time, all of those governments can be named, and it will be at the discretion of the claimant, the person making the application, as to who is going to have to come up with a compensation. It also requires that a claimant would disclose, maybe if they got, for example, from us, a safe operating grant, or if they got some funding from the state, they'd have to say what they got and how much they got, and then they'd have to prove their 2019 income by submitting their tax return. Now, one deficiency in the bill is that later in the bill it talks about 2020 information, but there's no requirement that that is provided in the bill as it is listed today. Now, again, the AG has the complete authority under this bill, and one of the things that concerns me about it is that when the AG is considering the application, they're looking at the nature of the property or the equitable and or contractual interest if the property is commandeered or used by the government. Now those are terms that come from other law but have been picked up in this law and seem to mean restrictions. And so that's a fairly troubling issue. But then it goes to say that the duration and nature of governmental commandering or use would be imposition of any curfew, occupation restriction, or restriction on operations. It talks about added duties that were required by the government to comply with the order, which I don't necessarily know what that would be. I guess maybe if you have masks or some kind of standards that are imposed through an ordinance or resolution. Reasonable costs and attorney fees to bring the claim. Extraordinary contributions by the business that benefited the general public of the state of Kansas, again without definition to understand truly what an extraordinary contribution would mean. And then any other factors that would come up in some of those various other laws, eminent domain or anything like that. So again, the Attorney General's office is the entity that has the sole discretion to basically go through this and value the claim. Now, when they value that claim, they will issue what's called a certificate of government use. And on that, it would include the value of compensation that the business was entitled to. And in a further section, it clarifies how that's going to be defined. So on that order, it will talk about the amount of credit owed. And again, if there were concurrent orders, if things were in place at the same time, it would list all of the governmental institutions, maybe state of Kansas and a county, or the state of Kansas and a city, for example. And then it gives the opportunity to seek tax credits. So in Section 5 of this bill, it calculates the credit. And this, this takes a minute, especially if you're reading the text of the bill itself. So basically, it says, if a business that operated in 2019 was closed, then your credit is basically 1 month's worth of your 2019 income tax liability times 30 days worth of however many days you were closed or restricted. That's if you were closed. Now, if you're restricted, it says that it's 1/48, so 1/4 of your monthly property tax liability for every 30 days that you're restricted. And again, starting May 1st, restricted equals face mask mandate. So then it goes on, and this is where I said there's kind of a deficiency in the law. If you were not open in 2019, if your business opened in 2020, then basically you get 1/6 of your 2020 income tax liability for every 30 days. And here's another deficiency in the law, where it was closed pursuant to an order of the governor of the state of Kansas. That's the only type of order where this is in effect. They couldn't come after the county here. Or 1/12 of their 2020 income tax liability for every 30 days that it was restricted. And then basically they go through and apply any of those loans or grants that were provided for federal or state COVID relief, and they back that out of the amount that's owed. And then if the credit exceeds that liability, basically the state will cut them a check and reimburse them. Now, Section 6 goes through the practicalities of applying it to 2021 and 2022, and kind of the details there. But then Section 7 is where it finally gets to us, and why this is not great for us. And so this section says, the owner of a building that operates a business on the property that was closed or restricted can apply to the governing body of the entity that imposes the order for reimbursement of any property taxes levied upon such property after December 31st, 2019. Like the last bill, it says that needs to be paid from the county's general fund or the city's general fund, whoever's general fund. The applicant, when they provide that information, basically says all it includes is a certificate of good use and an affidavit stating that any tax credits or property tax abatements previously received. So again, that can be taken into consideration. The law goes on to, or the bill goes on to say that if that application is complete, all the boxes are checked, then the governmental entity shall reimburse from its general fund that amount paid in property taxes, not to exceed, and this is another deficiency in the law, not to exceed the unused amount stated on the claimant's certificate of government use. Right now, if you've tracked with me through the beginning of this, you don't get an updated certificate of governmental use. They're calling for an affidavit to be submitted, so that basically we would have to do the computation. So that would be a technical challenge to work through. And then the part that is probably most troubling to me out of all of this is that if the paid property tax amount does not basically, if there's an amount left over, then they are able to take essentially a credit against their future property taxes over 10 years. The law doesn't tell, or the bill doesn't tell us, does that follow the property owner? Does that follow the building itself, right, the property? It doesn't say, do we have to prorate that over 10 years? It's just pretty ambiguous. And the logistics of trying to do that, I mean, our system is not built to do that. So the logistics of trying to do that are a little bit overwhelming. And then finally, Section 8, that doesn't necessarily apply to us, but is pretty confusing, basically directs the Department of Commerce to create a business loan forgiveness program for applicable businesses without defining who's applicable, and basically says that that business can then submit for a loan, and then it further directs that the loan will be turned into essentially a grant. It will be forgiven. So there's a lot of ambiguity in this Section 8. So it's a challenging bill anyway. It certainly would be detrimental to us, just because if a person chose to seek relief through county property taxes, then that could be the significant impact that we talked about before, but potentially even greater. One, because of curfews that are now allowed to have a role in this. That was never something we talked about before or considered as a part of our fiscal impact. And then again, because if there is a face mask mandate in place after 5/1, that additionally contributes to being a restriction. So, sorry to talk a lot, but there's a lot going on in that bill. And I'm happy to answer any questions.
Lindsay, get a quick clarification, that Section 5, I've read this bill. I'll just reserve comment. Anyway, in Section 5, it says, order of the governor of the state of Kansas or any other subdivision of the state. Next one, same thing, or subdivision. Are we considered a subdivision of the state?
We are a political subdivision of the state
So
of
Section
Kansas.
5 applies to us too then, related to
It would,
claims.
except for the portion about 2020. Because in that, here it says, for claimants not in operation in 2019,
Right.
1/6 of such claimants 2020, blah, 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 ceased operation pursuant to an order of the governor of the state of Kansas.
So but the 1/12 and 1/48 could apply to us.
Yes, the 1/12 and the 1/48 would apply to us. And then the second half of number 3, where it's 1/12 of Kansas claimants 2020 Kansas income tax would apply to us too.
Right.
So I think it was an unintentional oversight, probably by the revisor's office.
Well, I don't. Okay, thanks. Commissioner Howell?
So thank you, Chairman. Back to Section 5. That's an income tax provision. We don't normally receive funding from income taxes. And it looks to me like the funds to pay that would come out of the $100 million set aside. Is that correct?
If the claimant opts to choose that route to get reimbursed, yes, it would come from that $100 million pot. If they choose to come after us, because we did have orders in place, then the value of what they get to seek from us is based on their income taxes, but it comes out of the general fund based on the amount of property tax they paid.
So it'd be from property tax funds that we levied, paying back an income tax.
That would be how they would have computed it, was based on the income tax that they essentially would have lost.
Okay. Back to Section 7. It looks to me like the language there does not, I think you may have stated this, but I want to make sure I understood it correctly. It doesn't really get into a calculation on prorated damages.
No.
It just says all property taxes.
Mm-hmm. Yeah,
So-
that's why it's troubling to me, because it would appear to be, again, 100% of a property tax liability when we're 25 to 30% of that liability.
So also, let's talk about the trigger of this. So the state had a health order. Some counties chose to rescind the health order. Some counties chose to amend the health order. Some counties chose to enforce, we should say adopt or enforce or accept, should say accept the health order by maybe lack of action at all. In our case, I'd have to go back and look at all the different health orders, but I think we didn't actually have a mask mandate until sometime after July 4th. So, in fact, I would tell you, House Bill 2016 didn't even pass until, what was that, September-ish last year? I think it was around the right time. So, again, so is this liability that we would have based on our actions after that House Bill 2016 passed, or is this something that would happen liabilities to the county that happened before that date? Because I don't think we had any impact on changing policy whatsoever before that House bill came to us.
It basically says, the trigger date that I see in here is December 31st, 2019 and beyond. So based on that, I do believe that any order, and I think there's still room to quibble again. Was it the commissioner? Was it the local health officer? So I think there's still ambiguities. But certainly, I think anything after December 31st, 2019 is the intention of the bill.
So Wichita issued a mask mandate before the county did. Do they have any liability under this law?
The mask mandate portion doesn't become a restriction until May 1st of this year going
Oh,
forward.
I see. May 1st this year. Okay, that makes sense. All right. Do we have an estimate? I know it'd be hard to do this, but can we come up with some type of an estimate what this would cost the county should this pass in its current form?
Well, so much of it is based on what the claimant chooses. The claimant may choose to do entirely income tax credit, and so it may never impact us. But if we were to assume a worst-case scenario that they always chose the county, it would look a lot like what it looked like under the prior discussion that we had when it was roughly 24 to 50 million. But it actually, I would argue, would be worse because, like I said, that prior bill did not consider a curfew. This does.
I think the purpose of today's discussion is to decide whether or not we want to take a position on this bill. Okay, I'll just take personally, as I'm looking at what I've been presented so far, I've not read the bill yet, but based on what you've presented so far, the $100 million to the state of Kansas to provide business relief, I think that to me seems reasonable. I don't know that I would oppose that. I think that seems like something that's very pro-business, and I think there's obviously some undefined things in the bill that need to be cleaned up there, but the biggest concern I think we ought to have is whether it comes back to property taxes from Sedgwick County trying to go out and reimburse businesses. And again, I think that we ought to be sensitive to whether we want to continue health orders, understanding there's future liabilities potentially. I think this gives us a reason maybe to move away from a health order or from a mask mandate. I think this is additional evidence we might need to make that decision. But with respect to using property taxes to go backwards in time and reimburse businesses, I think that's my biggest concern is where does that funding come from, knowing that we've already provided the services that those dollars were intended to provide. So it's not like we're sitting on the money, waiting. We're just being mean and we don't want to give it back. The reality is those dollars were spent for services in Sedgwick County. So we would actually have to levy new taxes essentially to pay back the liability back to businesses should this pass in its current form. So that's my biggest concern. If we could split our positions, say, to the extent that $100 million might be useful for our community and get our businesses back on their feet, I think that might be good policy. But I would have some concern about the property tax portion of this. Thank you.
I'll mention just for the additional background for those that House bill that we discussed last time, and then I testified. That House bill was really a really bad, attempt at what it was, and it was. I don't see that going anywhere, but this one is very confusing. It's got a lot of pieces. I'll also mention that I felt like I was carrying the burden of all the counties because I was the only county person that testified, and our friends in the other populous counties and others were not present, and but that happened, and I think it was effective. And then we found out that many of the restaurants and others that were claiming then found out that there was a federal program, and many of them told me that they've remained whole for that lost revenue and everything else. Lost revenue meaning due to curfew, due to gathering sizes, table sizes, everything else. So there's been federal programs where and I think the president said maybe today or yesterday that today might be the last day to apply for one of those, that federal program. So I would encourage everybody that way. Personally, I don't feel like carrying the water again, one way or another. It's got so many pieces, as Commissioner Howell said. I can't even imagine that we could say, well, we like this and not that, and like this and not that by, when's the testifying? Thursday?
Mr. Chairman, Mike Papoon, County Councilor. Yeah, I want to clarify a few things. The reason this came up to us is our lobbyist, Jason Watkins, pointed out that there'd be a hearing this Thursday morning at 9:30 before Senate Tax Committee on two bills of particular interest to us, 286, which is the bill we're discussing right now, and Senate Bill 149, which is an exact duplicate of House Bill 2142, which you testified against, Mr. Chairman. To clarify something I said earlier, there isn't a hearing on 2142 today. That bill, as far as we know, is dead. And I don't know that there's any reason to submit testimony on Senate Bill 149 because that appears to be as dead as 2142.
It's the House bill.
But I think 286 will have some traction with a good portion of the legislature, and it's something we have to think about. And Mr. Watkins was just wondering if we were going to take a position on that particular bill. I was communicating with a colleague that I know in Johnson County that's involved with their legislative process, and it's my understanding is they're not officially taking a position or testifying one way or the other on this bill at this point. They'll be working on it in the background, I think, to try to soften it as much as it can for counties. But being told that we don't think that we can get the retroactive provision taken out of this bill, that's going to be a pretty hard sell not to go back to December 31, 2019. So I don't know that it would do any good to submit testimony that I sent you yesterday in opposition to Senate Bill 149 because I don't think that bill's going anywhere. As far as this bill, as the chairman said, it's got a lot of moving pieces. I don't know whether or not we need to be opposition or support it with changes or however we'd want to do it. We may want to just see how the hearing goes on Thursday and react from then. If the Senate Tax Committees, if the history, as we saw in Senate Bill 13, is probably going to get run through pretty quickly anyway. They have three bills they're considering this Thursday morning for an hour committee hearing. The chairman was up in Topeka on a 2-hour hearing on Senate Bill 2142. So I think we probably have more opportunity in the House side of things to have a discussion about some of the things we might want to get changed in this bill. But unless the commission wants us to draft some testimony in opposition, I don't know how we should proceed on this. I will say, though, editorializing a little bit about this bill, it appears that the legislature, through this legislation and through some KEMA legislation, which we haven't even addressed as a commission yet, which of both Senate and House versions of KEMA have passed their respective chambers or in conference committee, there's a significant effort to essentially gut our decision-making ability as the Board of Health and our ability for the health officer to take action. And they're doing this by penalizing us if we now go so far as to even have a mass mandate after May 1. So I think it may behoove us at some point to have Mr. Watkins come in and talk about the KEMA legislation, talk about these property tax reimbursement bills, and just see what effect it has on the county commission, because I think the public expects the Board of Health and the health officer to take action in particular matters, but it's clear from these legislation that they're blaming the entire pandemic and its effect on businesses on county shutdowns or government shutdowns or state shutdowns. And I just think that's unfair, and we need to look at the overarching view of this and how to react as a commission. Right. As I've said before, I think if the state wants to deal with the pandemic, let them take it over and relieve your duties as the Board of Health. But if they're going to let you be the Board of Health or expect you to be the Board of Health, then they ought to give you the power to take action without it devastating our taxing ability.
Retroactively.
Retroactively, yes.
Commissioner Dennis has a comment? Again, I prefer to just remain neutral at this point. But
No,
that's right. Go ahead.
Actually, I appreciate, Lindsay, you going through the details of the bill. But what I'm really interested in is the impact on Sedgwick County. Last August, we passed a budget for 2021, and that's what we're living in. And that's what the money that we have that we can spend. What I don't see from what you've told us so far is how, if say this bill passes in its current form, and we have to come up with $20 to $50 million someplace out of the general fund, what is the impact on Sedgwick County?
Well, so that would be, when we looked at this before, that essentially equates to 26% across the board cut in spending immediately to generate the budget authority necessary to pay this out. And so just as a reminder of what lives in the general fund, that includes everything from the sheriff, which has the largest budget, around 55 million. Actually, that's just spending. Their budget is actually larger. To the health department, to, as Commissioner Howell mentioned last time, the zoo and exploration place. So not only quality of life, but I mean, our core public safety, our 911 staffing is all out of the general fund. So all of those things would have a pretty immediate and critical impact. And when I had emailed folks last time to ask about that impact, everyone's story was pretty awful about what that service cut would mean to our community.
So what you're really saying is that in 2021 that we're in right now, we may end up having to cut 26% of the services that we're providing to the citizens in Sedgwick County if this bill passes.
That would be the worst case scenario, yes, sir.
Commissioner, and Commissioner, and that was part of the testimony that we written and verbalized the last time, but, so it is consistent with what we did, but I'm just saying, so yeah, we're on record anyway, and you're helping re-explain
But
it.
we need the press to pick this up.
Right, no, I know, I'm not
And we need to tell them that we're looking at a 26% cut in the services we're providing today, okay? If we get into this situation, what are our options? And when I'm talking about the options, what I'm asking is, can we borrow money someplace in order to be able to continue those services and then pay that back with a huge property tax increase in 2022, which we're going to have to follow Senate Bill 13, but we're going to have to sit down and say, because of what the legislature's done to us, we're going to have to hold a public meeting and say that we need a huge tax increase in 2022 in order to be able to pay back this loan. Is that an option?
It would be an option. There are short-term loans like that we could get, you're right, that would come with an astronomical interest rate and would have a pretty negative impact on our ability to sustain our credit rating and all of those things. The impact would be long-term, even if it was a short-term action.
I understand that, but is there any other option other than borrowing money in order to be able to continue our services? We're between a rock and a hard place. We're either going to cut 26% or we're going to have come up with the money someplace that's not in our budget.
Well, I think because the way the law is written, that it says it must come from the general fund, that's what really ties our hands on this. Because there is fund balance and we could go into that, but that automatically triggers what you're talking about. Down the road, we must do cuts. Certainly, if the state is able to use federal coronavirus relief funding to fund theirs, that would have been a nice option for them to have allowed counties to be able to do as well with our direct allocations. But they have not permitted that in the way this bill is written. That would be another option is to have that kind of change. But we would have to readopt a budget in order to get, even if we got a loan, we have to readopt a budget in order to have everybody be able to keep their spending authority plus have enough money to pay all of this back.
Okay. Well, I hope that a little over 2 hours into our staff meeting, the press is still with us, or they fast forward and get to this point, because this is a significant impact on Sedgwick County between cutting services or finding some way to recoup that money in order to be able to finance a very foolhardy bill, as in my opinion. Thank you, Mr. Chairman.
Mike?
Just quickly, Commissioner Dennis, and talking with our lobbyist and looking at the bill, I think the intent of the bill is to use the reason it's so hard to, and I know I asked Lindsay early on to come up with financial impact, and she said it would be very difficult because of all the different moving parts of this bill. But I think it's the intent of this bill for the first $100 million to cover a lot of these losses prior to the county having to reimburse property tax, is what I believe.
Well, my understanding is the individual can pick whether they want the income tax or the property tax.
Right, once you get to the income, but I mean, the first portion of the bill is the $100 million that the state would use from federal dollars, which it looks like the state's going to get. I think they're supposed to be getting over $1 billion, I think, in federal relief, and that $100 million would go to help reimburse businesses. So we think that the impact won't be nearly as large as what Senate Bill 149 would entail and what House Bill 2142 would entail. Not that it might not still have an impact, the very impact you're talking about, retroactively having to pay money that we've already spent, as Commissioner Howell said. But we're hoping that that $100 million will help alleviate our financial obligation.
But did I understand Lindsay to say that they can identify which governmental agency that they wanted to bill in this? And so if they all identified Sedgwick County, that $100 million doesn't count. Is that not true?
That is true. I'll find the text for you, Mike, here. It's on page 4, lines 25 through 27. It says all valid claims approved by the Attorney General for settlement shall be paid from funds then existing in the COVID-19 governmental use claims in lieu of payment of such claim. A claimant may elect either a tax credit or tax abatement or both as an exclusive remedy as further provided in this act. There are many things that make this bill not fun. That is one of them.
Very good. Well, I don't think that I'll go back on my statement that this is kind of a foolhardy bill right now. And not that I don't think that they'll probably pass it, but it's going to have an absolute devastating effect. Thank you.
All right. I don't see other comments. Thanks for the great news, Lindsay.
I'm full of it, aren't I?
Hakeem, do we have anything else? Because a few of us have some meetings. Or Tom, you have anything else? Okay, everybody. Well, thanks. Great conversation, great input, dialogue, questions. So thank you all. And we'll be meeting tomorrow at 9 o'clock. Thank you. We adjourn. Yeah, that's a crazy one. And then they hit us with this on in the weekend.
I'm not going to run for re-election, so I'll tell them what I do.
No, that's